Hello and welcome to MedCity's Pivot Podcast. Insurance companies are rapidly adopting machine learning and agentic AI to help reduce the administrative burden on physicians, and perhaps most importantly, to improve the member experience. How is Aetna achieving all of this as it deploys its agents across different workflows? Today, I'm talking to Nathan Frank, Chief Digital and Technology Officer at Aetna, the insurance business of CVS Health, who will shed light on this. Hello, and welcome, Nathan, to MedCity's Pivot Podcast.
Thank you. I'm excited to be here today. I'm excited to spend some time with you talking about everything healthcare technology.
Perfect. So, as you know, the theme of this episode is sort of agentic AI, which is hard to get away from AI these days. So, let's just, take the bull by the horns. I just wanted to get a sense of how Aetna is using agentic AI beyond sort of customer service phone calls, where voices has become such a huge part. So agentic AI without voice, with voice, how are you using it? Where is their most value?
Yeah, let me just start by acknowledging that healthcare is very complex. And there's lots of opportunity, obviously, in the U.S. healthcare system. And where we believe that we have the right assets and the right technology and the right people to transform healthcare through technology. But I want to start with where do we start as Aetna? We look at those friction points in the process first, and we then try to take those friction points out. And where we believe that agentic AI and technology can really drive that transformation is the human experience combined with AI to actually deliver better outcomes. And so, we have tons of examples where we're using AI to reduce that friction. And like you mentioned in the beginning, a lot of that is around the administrative burden. We're the only industry that assigns healthcare to consumers. If you just think about that for a moment, in no other industry do you walk away from a visit and have homework. So you're right. There's a lot of use cases today that we have in production where we're using voice. Maybe that's ambient listening. I think one of the best examples we have combines some of that voice and ambient listening with our clinicians, our nurses. So we have over 12,000 nurses that work every day in our care management organization. And if you think about someone who was recently diagnosed with cancer, and we know that we have tons of data across many of our different platforms and providers and different EHRs. We use AI to pull all of that information together from various sources. We have AI agents that do that, and they prepare those clinical notes for that visit. That allows our clinicians, our nurses who wanted to be in this profession, not to do a bunch of homework and paperwork, to spend more time with that patient to help them make sure they're getting the right care, that they have the right team, that they have transportation to and back from that physician visit. And then, of course, we're using ambient listening during the call that takes all that information, summarizes it, and enables better outcomes in future visits or future conversations. That one, as an example, is given our clinicians 90 minutes back per day. And so this isn't about reducing roles. This is about allowing us to spend more time with patients. I think that, to me, is a great example of where combining some of that ambient listening, but really using AI agents to go and pull out that information and really provide a better experience for our members.
So one of the key questions about AI is the issue of trust, right? How is this information being generated? What information is being left out? What information is deemed relevant by the AI algorithms, right? Is it hallucinating? So how do you approach the issue of trust? How often are you looking at these algorithms to make sure that there isn't model drift or, things like that?
Yeah, absolutely. Uh, so you're spot on. Trust is in healthcare is paramount, and we believe that we're in the best position to build that trust. Um, we believe in providing the best consumer experience, and I tell this story all the time. When I started this role 3 or 4 years ago, lots of my peers in the industry, I was trying to understand where we were making investments, and they were talking about cloud and talking about modernizing their platforms. And when I answered the question, it was around the member experience. So if you really do put the member or the patient at the center of that, you're naturally building trust because you're building the entire ecosystem around that experience. And so we believe in transparency. How do you build trust? When you're working with someone, you want them to know where AI is being used, and you want them to understand how it works in the process. So whether that's through your IVR or your outbound calling, or during the calls, we're letting them know that we're using the ambient listening to actually help with the experience. We also have a deep history of AI and machine learning and analytics at Aetna. We've been doing this for 10 plus years. We have 3,000 data scientists who have been hard at work on this. We have always been sort of an early adopter in this space. If you think about the early days, it was more around using machine learning for fraud, waste, and abuse, and some of those less consumer facing. But we also, if you think about where we sit in the CVS umbrella, CVS is one of the most trusted, healthcare brands in the country. So I think we're in a unique position there to make sure that we're being that trusted partner, and our team works every day to make sure that the data that we're using is used appropriately. We also do something, I think, something unique in terms of our product model. We've been a product oriented organization for a number of years. We have actually clinicians sitting in small pods with our UX and our customer experience designers and our software engineers. And those small pods of people are creating amazing experiences, but they're also getting that expertise from the frontline clinicians. So we built in very early on the ability to help us every single interaction. Was that successful? What could change? And so we have that coming in from the clinicians, and then all of the right responsible use guardrails, on the back end.
So you mentioned CVS Health being a trusted brand, and I don't disagree with that. But the vertical that you work under, Aetna, and I don't mean Aetna per se, but broadly, insurance companies are, I almost want to say insurance companies are hated. Aetna doesn't receive the same level of ire that United Healthcare does. But when you look at consumer sentiment on insurance companies, it is not positive. So you're starting from a deficit and you're bringing in a technology that the average person may not understand and is generally afraid of. So you have a steep mountain to climb. So I'm wondering if you can give examples of how you're approaching that. I mean, are you aware? Because the reason I ask this is I recently went to United Healthcare. They had invited journalists in, and it seemed to me that they were projecting an image of they are so wonderful and they are doing such good things and people just don't understand it. And so if we let all these journalists in and we let influencers in, that they will understand how dedicated we are, how compassionate we are. And I just think that I don't want to say this ship has sailed on that, but it is just fundamentally misunderstanding where consumer sentiment lies when it comes to insurance companies. So, but just wanted you to address that.
Yeah, I don't want to comment on United Healthcare.
Sure.
Obviously, they're a competitor. But what I will say is, Aetna is a 170 plus year old company. We have a deep history in healthcare, and we have amazing clinicians and colleagues that work every single day. And we've spent a lot of time and effort in our history differentiating ourselves with that member and clinical experience. And we think that, again, healthcare is really complex. If we can provide that human plus technology interaction, if we can, help build that trust, we will be the most trusted, brand in healthcare. And, we have the best, app experience out of all the payers. We have the best web experience. And in each one of those interactions, I think you're building the trust. And, that's the goal of our organization and the colleagues that work with us.
You talked about friction point in the beginning, and I think the pair provider push and pull has really come to the fore. And I've heard a lot of angst over the pair AI versus the provider AI, and and then this battle of AIs are happening. You have this agent, you have that agent. Where does the human being fit into all of this? And if AI is constantly flagging certain things for denial, for automatic denial, because they don't, a member may not have a certain coverage in their policy, where does how should I put it? Could it not create even more administrative burden because the technology is so fast and maybe denying certain things?
So just before we get into the answer here, at Aetna and in CVS Health, we don't use AI to deny care. It's that is deeply, rooted in our policies and our strategy. So just to take that off the table, we don't use AI to do any denials of care. So if we'll use AI for auto approvals, we'll use it to help with administrative burden, we'll use it to help with the experience. But we do have our clinicians, review cases that might have missing information or things like that.
Okay.
It's interesting. We do an annual provider survey through Aetna, and what we're seeing and what we're hearing from the providers is that almost 84% of those providers believe that the advances in technology like AI and agentic AI will lead to better outcomes. So we know that the industry thinks this will be helpful to the experience. And so where we come in, and I think we've done something unique over the past 2 years. Like I said, when I started here, we were really focused on member experience and how do we really think about the consumer and at the heart of that. Along the way, we found ourselves talking to providers and members and patients, and the providers play a key role in the satisfaction of a member. If you as a patient or me as a consumer in healthcare go visit my provider and they're not having a good experience with their health plan, it's naturally gonna kind of cloud the visit. And so we have a very close relationship with our provider network. We actually had our first annual Aetna Provider Forum last year, where we brought in a number of providers and very transparent in where we were going with our strategy around interoperability, clinical data exchange. How do we actually not have agent to agents? To your point, going back and forth, how do we make this more seamless real-time experiences? And overwhelmingly, the group said, hey, this is really the first conversation of this type that we've had in the industry. And it's led to a lot of partnerships and a lot of innovative thinking, and how do we connect and how do we have a better relationship in terms of sharing that data. I think that's really the next transformation for the industry. If you think about prior authorizations or clinical data exchange or claim status, all of these things, they can be done, have real-time information exchanged. Now, there has to be a two-way street there. And so we have, the APIs, and we have that connectivity that we think is, best in industry. And now it's, helping the providers, whether it's through their EHR that they use, or, a direct connection to them to make that experience better for our members, and their patients.
Let's switch gears a little bit. MedCity News has a lot of writes a lot about startups that are developing the next most interesting technology, and obviously there's a glut of AI companies in healthcare now. How do you evaluate technologies? If a startup wants to work with you, what would be the best way to reach out?
Yeah, that's you are right. There are tons of startups out there, and there's some amazing innovation in healthcare.
Mhm.
And but there's a lot to sort through.
There's a
If
lot of
I told you how
nonsense.
much,
I'm sorry to
yeah,
interrupt, but there's a lot of, because the barrier to entry has become so low. You have companies that probably have zero experience in healthcare touting the
that's right.
next greatest tool, right?
That's right. A couple of things. We have CVS Health Ventures organization that does an amazing job, and we've been recognized in the industry for the work there. They are on the forefront of these, startups and where the investments are going. So they are a great um, uh, kind of funnel for innovation that comes in. And there's lots of times that they bring amazing companies to us with amazing leadership teams. And then we decide if that's the right fit for us in terms of, do we build versus buy? Do we
Mhm.
have something that we'd want to, invest in and design our own product? That first and foremost is a great funnel. Second, we have great relationships in the industry, and we're able to go out there, and whether we're investing in these startups or they're coming through various forums and other other ways that we go out and take a look at them. What I find is they can have amazing ideas and amazing products, but do they have the healthcare experience,
Mhm.
and do they have the data, and do they have the interoperability to make this work? And so uh, we do a lot of test and learn opportunities with the smaller startups and some of the bigger ones. And we have a structured way that we ensure that we're, doing the right bake-offs, and we'll actually have a couple in production at any given time to make sure that we're doing sort of that A/B testing. And this is moving so fast,
Right.
that some will make it through, and some won't.
Is there any particular technology that you've seen that you feel really excited about when it comes to AI or even agentic AI?
Yeah, everything was about the frontier AI companies, and we deal with all of them.
Mhm.
I do think that the ability for us to think about what model is best, and then how do you manage the cost of that.
Mhm.
What I think all of us are struggling a little bit is, we have the frontier AI companies with amazing technologies attempting to go out there and monetize now the investments they've made.
Mhm.
And what we're finding is, you have to think about the costs in healthcare. We all want to, make sure that we're managing that appropriately. So, how do you use, some of the maybe lower cost models to do work that, the higher cost models used to do?
Mhm.
And to me, I think you're going to see a lot more of how do you route the workflows across to the right models in the right use case, which adds another layer of complexity and on how you're doing all this.
Mhm.
I also, and I know we talked about voice, you know, inbound and ambient listening and all of um, things, but you know, what I'd like to see is, actually AI agents out there doing work on behalf of you as the consumer,
Mhm.
right? We know that appointment scheduling is challenging. You're going to have to make the call. You're going to have to get, someone on the phone at the provider. You're going to have to go through the EHR or their front end. If we can take all that homework from you, and like I said in the beginning, we're the only industry that assigns you that. If you need to go see a specialist, if you need to go see your primary care physician, it should be as easy as going into our app, using our AI, scheduler, selecting the day and times you think you're going to be available, and let the AI agent go do that matching for you, right? And whether that's the AI agent actually doing the outbound calls, or it's the AI agent choosing to do that bi-directional data exchange because we have it set up with a provider, you shouldn't have to see that as a consumer. You should know that you trust us, you trust the AI agent, and then they're going to go do the homework to schedule that appointment for you.
How far away do you think we are from average, people like me having an AI agent that talks to CVS's AI agent and schedules call and things, schedules an appointment, and the calendar, the appointment just shows up on my calendar? How
We
far?
actually have that in production today. We released an early version a couple of months ago, and now we're going to start to scale that. But I think a fully AI autonomous agent that helps you manage your healthcare, that is something that we're working on at CVS Health, and you're going to have that in your hands in the next year.
So wait, if I'm a CVS Health member, I will have an AI agent dedicated to my care
Mhm.
where I don't have to prompt it to do anything, or
Well, you're going to have to interface with it either through
video.
voice or,
Yeah.
or some level of prompting, but that agent's going to know about you. It's going to have your, not just your, healthcare from a payer perspective, but it's going to understand who you are, your preferences. You're going to be able to load, your medical records. And, I think that's, that's where the future is. I will say, again, we talked about trust earlier. We want to be that trusted healthcare brand, right? We want to be transparent in where we're using AI because we see the future of healthcare, and we know that members are going to naturally gravitate to the healthcare companies that they trust. We have the best combination of AI, humans, and in the CVS Health scenario, physical presence as well.
You paint a very tantalizing future, but I feel, not just as a journalist where I'm designed to be skeptical, but even as an observer of the healthcare system, we are building a lot of amazing tools on top of very siloed, systems that have structural issues. For an AI agent, AI healthcare agent for every person, everything underneath needs to be, you know, interoperable A plus 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 to get to the point where that agent has an entire view of the person's health system. How do we build that on top of structures that are pretty siloed, even though we've made progress with HL7, with, all these different interoperability measures that both the government and companies are making?
Um, so if you think about the history here of healthcare in America, you're right. There's lots of legacy systems, but I'd say that about, lots of industries. If you think about finance and others, everyone has to deal with the legacy technology that's been out there over time. And I think the amazing thing about AI and agentic AI is that it does provide the ability to either help you upgrade and help you transform, right? Now, especially with the advancements in AI coding and the ability to use AI to actually translate, transform, and rebuild, that's one aspect. But there's also it's also a necessity. Some of these platforms are built and designed specifically claims processing as an example, right? We process over 500 million claims a year. Uh, I, I don't know that AI is going to come in and do claim processing better, high transaction volume, but when you have multiple systems and multiple records and you have to traverse those and pull data out, AI is the perfect solution for that. And I think over time you're going to see that, and I'm not a believer in the software apocalypse. I do not think that AI is gonna replace all enterprise software. I believe that it's going to augment it. It's going to help us transform it, and it's going to help accelerate the modernization, but it's not going to replace every enterprise software out there in the world. I just don't see that in the near term.
Well, on that hopeful note, Nathan, thank you so much for spending some time with us today.
Awesome. It was great. It was nice meeting you. Thank you so much.